my first night back in 3 months since I went on maternity leave and my baby was born on January 1st. So far, I saw the charge nurse break down sobbing. They're converting our unit to a entirely COVID unit, building indoors, making all the rooms negative pressure rooms. I walked in, they gave me one face shield, one N95, and one surgical mask. I haven't seen my coworkers in 100 days, and a few people asked me to see the baby pictures, see how she's doing, but really the thing that kind of is covering for the entire hospital is this: we're being overwhelmed, the deaths, the deceased, all the while knowing that this is just the beginning. I just went to an action this morning in the Bronx. It's the first action that I know of in New York City this week by nurses due to like the risks and fear of retaliation. It was organized by Jacobi Hospital nurses.
We need like ASAP equipment. We have nurses that are dying.
I'm here to help to save somebody's lives. No, I'm fighting for my own life.
Because it's just a matter of time of when am I positive? When am I going to be intubated? When am I going to pass away?
Can you tell us who you are?
I'm a dad. She's a first-year nurse, and I'm so proud of her. And now she's doing a job that could kill her.
So it's late. I didn't work tonight. I heard that one of the nurses that I used to work with is in the ICU. She taught me on the unit. I was a new nurse when I knew her, and I was really lost. I was really afraid. I was easily discouraged because even then there was so much wrong. And now she's in the ICU because she kept coming to work, and I just can't help but think that being a collective force of primarily women, many immigrant, many women of color, particularly in New York City, that our lives are somehow expendable. Monday morning, childcare stuff. We dropped off Maya, my 3-month-old, to the childcare for essential workers. I'm kind of psyching myself up for tonight. The Mount Sinai Health System, which runs 7 hospitals citywide, is going to deploy nurses to the location in Brooklyn because 30 to 40% of the staff are out sick. They're sending car service to nurses. This hospital is a good hour and a half away from the place that I usually work. I've never been inside the hospital, but I'm supposed to go to the nursing administration office and get an assignment. They get about 3 to 4 rapid response team calls per hour. And that's like when a patient acutely declines. The last thing that I heard or that I was told was that the morgue is full. I'm heading into the hospital now from home. We're already working short. We've been this way for years. Cuomo never made good on his promise to pass legislation for safe staffing ratios. We'll see how it goes tonight. I just asked my manager to give them a heads up that I have to be pumping every 3 or 4 hours. I just got home from my shift. When we walked in, we saw physicians, I think residents who were there, and they had like construction suits on, like those white zip-up things, and like goggles, clearly like brought in from outside. And by the end of the night, we had run out of gowns, so I definitely entered patients' rooms without a gown in order to draw blood.
Medical workers have reported using trash bags as protective gear in New York State. The death toll has passed 4,000. In New York City, the hospitals are overflowing. Mayor Bill de Blasio said Sunday the city has enough medical supplies to last until Tuesday or Wednesday.
This guy, yesterday, he dropped off a bunch of masks that he got shipped from his mom in Hong Kong. So I'm bringing them to the nurses. Can you imagine, like, neighborhood folks are bringing nurses masks? It's crazy.
Nurses outside Harlem Hospital demanding better protection against the coronavirus. They have to wear the same mask for 5 shifts.
We've been fighting for safe staffing. Cuomo never did a thing to help us with that. He now is the big man in town talking the big talk like he's out to protect us. But where is the PPE? Where are the ventilators? The governors are bidding one by one. We don't have time for no prices right. We need the PPE. We should nationalize the industries now.
This is a Starbucks that I used to go to going into shift. Buses empty, folks walking around, most of them wearing surgical masks. I'm a few hours into shift. I'm pretty exhausted already. They give us these N95 masks, and we wear a surgical mask on top to protect our N95 mask. And on top of that, we have a face shield. For sure, this setting is a lot more controlled, less hectic than where I was at the last time I worked. But I have 2 patients in an isolation negative pressure room, which is very unorthodox. I had to change the shift during huddle. The charge nurse, she was talking about how even after this pandemic is over, there will be our own trauma and our own sense of loss. There were moments where I was able to be with my patients, like really be with them.